Hi, this is Lee, licensed acupuncturist and herbalist. I have my office manager Bob here, and Bob recently developed this vitamin coughing with a phlegm, right?
Yeah, I couldn't stop coughing. I mean, I was a couple of days in a row, couldn't seem to get rid of it, and
What's the other symptoms? Chest pain you had?
I ended up with chest pain and dizzy and shortness of breath. I could not catch my breath.
So how many days lasted before you drove yourself to ER?
Might have just been a day or two, but as soon as I developed the bad chest pain and the shortness of breath, I drove myself to the hospital.
So in ER, the first thing they did is your EKG.
The first thing they did was an EKG.
Uh-huh.
They took some blood work immediately.
Uh-huh.
Then as soon as I came in, they were great. I told them I had chest pain. They took me right away. They put me in a wheelchair, pulled me over. They took the EKG. They put me in the corner of that room, and then they came and they took me down to a room where a doctor pretty much immediately came in and ordered the blood work. I'd say within a half hour they had a portable x-ray come in and take a chest x-ray and a heart x-ray.
So you said the x-ray shows there's no pneumonia. You also did a CT scan, right?
Right.
And there's no pneumonia. So that's not the lung infection, but the coughing, I was thinking either it's cold or virus infection, because you don't have fever, right?
No.
You have sore throat?
A little bit of a sore throat.
Little bit of sore throat. So either
and
it's
a lot of phlegm and a lot of coughing, and the coughing is what broke the phlegm up. I had a cup alongside of my chair, and I would have to spit the phlegm into the cup.
What kind of color is the phlegm, and is it thick? Is it yellow, green, white?
More white.
More white. So that more white indicating there's no bacteria infection. So that means you probably started with a cold or virus infection, but it hasn't triggered the bacteria infection. Once you see the phlegm turns yellow, that's the bacteria get involved. And then if it turns green, that's even worse. So the cold or virus infection, whatever it is, it can trigger your body release histamine. That's number one. So the histamine will cause your blood vessel leaking. And that blood vessel leaking not only in the chest causing phlegm, throat causing phlegm, but also it can cause your blood vessel leaking in the legs, in the peripheral area, and that will cause the heart problem. That's number one. Number two, when you have virus infection or cold, your immune system is kind of out of balance. So it tends to either produce different kind of a chemical to kill the virus or the common bacteria. That also can make your body produce some antibody, even attack your lung, your heart. So you may not have lung infection, but you can have lung inflammation. So inflammation is the key to prevent the heart problem. And what's the diagnosis for the heart?
Well, congestive heart failure, and basically my heart is not pumping enough blood to the body. So they've given me the medication, and they also gave me a diuretic or a water pill. So they've given me a medication that will help strengthen the heart, and they want me to take it easy for a week or so, and then after I see the doctor, they're going to give me some cardio exercises.
Yes, so to become stronger and prevent the further problems, number one, we got to clear up this phlegm and the coughing and phlegm. We already take the herbs for 3 times.
Mhm.
It seems the phlegm is a little better. It's easy to cough up. Because if it's a phlegm accumulating in the lung, then it will cause more inflammation in the lung. And then the lung function will influence the heart. So that's number 1. Clear up the phlegm, stop the coughing. Number 2, clear up the inflammation by lowering histamine. So like cheese, go easy with the cheese. Watching the salt. Anything above 100 milligram per serving, you have to get rid of that. So the cheese have 200 milligram, go easy with that. Cheese can induce histamine, and also crackers, all of the processed food have higher content of the salt. And nuts and seeds can induce the histamine, wine, or too much sugar. So sugar, salt, nuts and seeds, alcohol, all of this will induce more histamine, more inflammation, either in the lung or the leaking in your legs. It all increase the chances of the heart failure. So if we can control this coughing, lower the histamine, reduce the inflammation, then your heart will become stronger.
Yeah, I'm gonna have to look over my diet and make some very quick changes.